Ladies and gentlemen, good morning. And is it still morning? Yes, it is. I think or just into the afternoon. Thank you for joining us on behalf of the Northwest University. We are having another webinar where you can listen to our experts speak. Today we focus on Indigenous knowledge systems. And for the official opening and welcoming, I'm going to turn to our Deputy Dean, Teaching and Learning in the Faculty of Natural and Agricultural Sciences, Professor Helen Drummond.
Thank you. I'd just like to welcome everybody. So I have a very pleasant and a very easy task this morning. Welcome to everyone who's logged on for this webinar. If you're not really aware of the background of the IKS Centre, we have a Bachelor of Indigenous Knowledge Systems, and we work in partnership with government departments like Department of Science and Technology, now Science and Innovation, and Department of Arts and Culture. Our first graduates graduated in 2017. And in this webinar, I think our main aim is to explore the impact that COVID-19 has had on teaching, learning, research, and community engagement with regard to IKS. So we have students here, undergraduate and postgraduate, and staff members, and Indigenous knowledge holders and practitioners who are going to share a little bit of their insights and challenges and prospects and strategies, and how this impacts on teaching and learning and research and, of course, community engagement at NWU. So without further ado, I'd like to welcome everybody here, and we look forward to hearing what is going to be said today. Thank you.
Thank you so much, Professor Drummond. It's an honor to have you here at the start of this webinar. Ladies and gentlemen, every time I listen to the experts in Indigenous knowledge systems, I am beyond impressed. It's as if they open up worlds, which is typically something that we do at the Northwest University. To start things off with the webinar, I'm going to go to the director of the Indigenous Knowledge Systems Center, Dr. Koitsiwe. Now, Dr. Koitsiwe is going to talk to us a little bit about the future of Indigenous knowledge systems. Dr. Mateo, we are in your hands.
Thank you, Program Director. And also, let me also welcome all the participants in this live IKS webinar series. And I also want to thank the deanery represented by Professor Drummond. And I'm also aware that in the neighborhood or in the online also, there is a presence of Professor Maditsi, the Executive Dean, and there's also the presence of Professor Gilbert Kunabal, the Deputy Dean for Research and Innovation in the Faculty of Natural and Agricultural Sciences. So without any further ado, colleagues, I think it's very important that we meet on this day to come and discuss actually the impact of COVID-19. As you know, that COVID-19 is an urgency for everybody in the global world now. It doesn't matter of where you come from, if you are from Asia, China, Africa, you are white, black, educated, poor or rich. COVID-19 have actually showed us that as humanity, somewhere, somehow, we need to come together, especially when we are facing challenges like this one, which are actually threatening the existence of humanity. So without any further ado, I will go into my topic. And I can also, in this webinar, recognize the presence, I think, of DDG Butichuma from the Premier Office, the Institutional Development Support, which I think is very important for us to have this important stakeholder relationship, like Prof Drummond have said. So colleagues, in terms of the future of IKS, I think it's very important for us to zoom into the future of IKS, as we know that even these days, the command of the information communication technology is not anything that can run away from. So I think our future in terms of IKS, especially in the academic institutions or in higher institutions of learning, cannot be looked outside, the spectacles of globalization, information communication, like your fourth industrial revolution. As you can see even now, we're having a visual online meeting to discuss issues of IKS. So I think it's very important for us to know that. But in terms of providing the historical backdrop quickly, in terms of where we come from, in terms of indigenous knowledge systems at Northwest University, I always like to say it is very important for us to blow our own trumpet. Northwest University in South Africa and in Africa as a whole, it is a pioneer of African indigenous knowledge systems. I think as far as 2001, the Northwest University introduced the Bachelor of Arts in Indigenous Knowledge Systems. It was hosted by the Faculty of Human and Social Sciences, which is currently called the Faculty of Humanities. And this research program, or this program on Indigenous Knowledge Systems, it was not only the undergraduate, they also had the Masters of Arts in IKS and also the Ph.D. in IKS. But recently, due to engagements with the management and also with our stakeholders, those programs in Faculty of Humanities have been phased off. And we have managed to meet with the Department of Science and Innovation, the Indigenous Knowledge Systems practitioners or the knowledge holders and other stakeholders to come up with a new degree, which is called the Bachelor of Indigenous Knowledge Systems, which is currently hosted by the Faculty of Natural and Agricultural Sciences, where Prof Drummond and Prof Modise and Prof Gilbert Groenewald and Professor Midupi are the executive deanry, and it is hosted by the IKS Center, which is also part of the consortium of 5 universities under the DSI and NRF Center of IKS, which is at the University of KwaZulu-Natal. It includes University of South Africa, University of Venda, University of Limpopo, ourselves as Northwest University, and the University of KwaZulu-Natal. So you can see that it's very important for us to come together to see how we can come up with programs of transformation of our education system and also decolonization of the curriculum, because that is very important. As Northwest University, we're also working towards a unitary model of saying that Northwest University should speak with one voice. And one of our vision is to make sure that we make impact in the communities that are facing challenges of poverty, inequality, and unemployment, because indigenous knowledge systems comes from the community. It is knowledge which is based in the community. So you can realize that the future of IKS, it is bright, because as we are saying, IKS now, there is a growing awareness of the importance of IKS, not only in development, but also in curriculum development, but also in what we call economic development for our own local communities. There are so many cases, as we are saying, and there are also interdepartmental committees in our government that works towards how we can actually look at IKS in terms of ensuring that there are innovation on the ground. So as Prof Drummond have said, the BIKS, which started in 2013 at Northwest University, which is a new program, its first cohort graduated on the 24th of April 2017. And this was the first students in Africa who have graduated in an Africa-centered program, which teaches us about our own knowledge systems and how we can interface these knowledge systems with other knowledge systems, because African knowledge systems cannot be a panacea on its own. But there is also no knowledge which is superior to any other knowledge. So all knowledge, whether Asian, European, African, they're also very important for our own survivors as human beings. But as we can see, the University of Venda also started their own program in 2014. So you can see that Northwest University is a leading institution in terms of IKS. So at the University of Venda, under the Department of African Studies in the Faculty of Human and Social Sciences, they also offer the same program. And we are providing guidance to these institutions. And I was also told that University of Limpopo is on a process of starting theirs maybe next year, which is 2021 or 2022. So there is a growing interest, and other universities are doing IKS in terms of only research projects where they have students in masters, in PhD who are studying. But Northwest University have got those undergraduates postgraduate programs, and we're also doing research and also community engagement with the local communities that we have. So COVID-19, as we have said, colleagues, it shows us that as humanity and also as institutions of higher learning, especially in IKS, there is a need for us to devise new strategies in terms of how we engage with our students and how we assess our students, and also what forms and what models can we introduce to ensure that there is effective online teaching and learning, and how do we reintegrate back our students into campus, because now we are going into the second semester whereby there will be a lot of things. I know I've got only a few minutes, colleagues, but in terms of IKS, in terms of its future, I would like to say briefly that the future of IKS, it lies within the multilingual pedagogies that we want to establish in the university, whereby multilingualism, it becomes a currency now in the global world. And also there is a need now to come up with new pedagogies. And in this instance, we are looking at introducing African indigenous pedagogies. And as you also know, colleagues, there is the IKS policy of 2004, which was also looking towards the legalization of African knowledge systems. And recently, we've got the IKS Act. And also at Northwest University, we've got now the language policy, whereby different faculties came up with their own language plans. And now at IKS, we want to see how we can use languages like Setswana and others in teaching our own students and doing research. That's very important. And also another point I want to talk about is about the institutionalization of IKS at Northwest University. As we have seen in the past, Mafikeng campus was the only campus that was actually offering programs in IKS, except the pockets of research that have been done in Porsche and also in Val. So we need some kind of a coordinated structure that will institutionalize IKS in the university, because some academics are still in the dark about IKS, and some also don't think that these programs are actually vital in university. So we have to create that awareness, and we must make sure that we avoid departmentalization of IKS, because IKS cannot be relegated to one faculty, like natural and agricultural sciences or humanities. Other faculties must also be involved in the development of IKS. So there is a need to reconceptualize the future of IKS, because the future is changing and it is also transforming. One of the last points that I want to make is to say that as we are aware now, the case of Lengana in the global world has made a lot of significance in terms of the use of African traditional medicine. And yesterday, it was the beginning of the African Traditional Medicine Week, which is globally celebrated. And we also need to show that there are also bioprospecting innovation platforms that we develop in the university, where scientists, knowledge holders, and researchers and our students come together in areas of developing nanotechnology, synthetic biology, IKS and information communication technology, and issues of the big data, because we also need to know how IKS can also go into this big data analytics, and also how do we come up with our own survival analytics, because it's very important for us to diagnose as the IKS center where we are, where we come from, and what kind of strategic plans we can come up with in a short, in a medium, and also in a long-term level. But also another last point is about IKS funding. As you are aware that the Minister of Finance have also introduced the concept of zero budgeting, IKS as a project in the country and the center, we need a lot of funding, and we also need to leverage funding from government and also from the private sector. Lastly, partnerships, collaborations, and networks are also very important. We need to network with other institutions. Like in this case, we have Northwest Provincial Government, which have signed a memorandum of understanding with the university. We also work with CSIR, we work with the Department of Science and Innovation. But what is also very important for us as the IKS Center, we need to develop community networks, effective community networks on the ground. And we also need to lobby very strongly and to develop advocacy strategies for IKS. In conclusions, colleagues, I would like to say the time for looking at IKS as a problem has passed. Now it is the time for us to embrace and interface IKS in our programs in order to provide solutions. We have currently the problem of COVID-19, which is not taking into considerations whether you are black, you are white, or you are poor or rich. Knowledge is not superior, and no knowledge can be superior to another knowledge. And we need to embrace all knowledge systems. And in the final analysis, the future of IKS is in the hands of the knowledge holders, in the hands of the IKS ambassadors, who are our young students that we are training in collaboration with scientists, in collaboration with government, with private sector, and other relevant stakeholders, in order to make sure that we also engage knowledge holders as core planners, as core managers, and core owners of IKS in our own institutions of higher learning. With that short presentation.
Thank you so much, Doctor. We really appreciate it. It seems if you are well situated and well structured to take us into the future. Ladies and gentlemen, we're going to bring you a broad spectrum of perspectives during this webinar. And you've heard Dr. Mateo speak about the young ones coming through. So we are first going to go to Ms. Sebea, who is currently a first-year student in Indigenous Knowledge Systems. And we'd just like to hear, a bit of news from her perspectives and how she experiences studying at the Northwest University. Ms. Sebea.
Thank you, sir. My name is Busi Sebea, and I'm an undergraduate student at Northwest University. And my experiences as a first-year student, I had encountered a lot of experiences and challenges as I was new and expected the teaching and learning to be direct, and from my lecturers and from my student assistants. And unfortunately, I didn't have that, and I was not close to people like that to give me assistance or guidance. And it was a challenge for me. Not being in class and things being explained to me, it was also in a content manner, it was also a challenge for me. It was difficult for me to get through my studies, as I felt like I needed more guidance from my lecturers, and as much as my lecturers were always there for that. And I felt like a direct contact classes were going to be easier, because that's where I would be able to interact with my lecturers, being able to ask questions, and in a closed way. The most prominent fact are the issue of devices and smartphones. During the level 3 and level 4, we encountered an experience, a total shutdown, where libraries are closed and computer labs were closed. I couldn't be able to complete some of my assignments that were given there in my tests and also my quizzes. And but I was able to download a Word document using my smartphone. It wasn't a good process, and it was a slow process to type in all the assignments that were given to me. And I could not submit some of the assignments that were given to me. The issue of data. Issue of data is the major issue today, especially to those who are able to receive data every day, as I had to send emails, WhatsApp, text, SMSs to the school representatives or the school council to be able to have data. On campus, where I did not have data, I was required to go to the library in order to be able to gather information, to be able to complete my assignment and some of the tests that I was given. I had to miss online sessions with some of the lectures due to not having data. The issue of network connectivity. I had conversations with my fellow colleagues, and they are from rural areas of farms where the network connectivity is poor. Some had to spend days without network, and by then they could have missed a lot of sessions that we had with some of the lecturers, and they could be left behind for that. The issue of the environment. Studying at home is a difficult thing to do, especially having to deal with a lot of distractions, doing house chores, taking care of others, while having a lot of work to do, assignments, tests, and also study. The issue of deadline. Working under pressure and having a lot of assignments to do at a short period of time was a difficult thing to do. And with no clarification or with no explanation, it was also difficult to do. I want to give an example of my lady peer, who is one of the students in DIKS, when lecturers and students were not able to get hold to because or due to experiencing issues such as data network connectivity, also issues such as not having smartphone devices. And at the end of the day, she was one of the students that did not have any results whatsoever. And the solutions on how I dealt with such situations were that I was able to sleep late, to be able to type in my work, to be able to study, to be able to write all the work that I had there. And also I was able to go to the libraries that were closed in order to be able to do my work without any distractions there. In closing, I want to give credits to all the lecturers that made it possible for the online learning, to give us extension dates, lecturers that made it possible to have, to give a second opportunity to be able to submit our work, lecturers that made it possible to give us, to make this online sessions such an easy thing. And I think.
Thank you so much, Ms. Sebea. We appreciate your contributions here. We're sticking to the undergraduate students, and now we're moving to a second year student, Ms. Risimati. We are in your hands. Share with us some of your experiences.
Good day, everyone. My name is Vanessa Risimati, and I'm a second year IKS student. I would like to start off by thanking Dr. Koitsiwe along with the Center for affording me the opportunity to share my academic experience with you. And I would like to believe that all the undergraduate IKS students will concur with me when I say that before the pandemic, we had all the necessary tools and resources that actually helped, that actually made our academic lives less challenging. As the institution had put in place a system that ensured that everything ran smoothly, starting with 5 days a week contact classes, which we attended on an average of 2 to 4 hours a day. Easy access to the 24 hours library, which was open 7 days a week. Easy access to the 24 hours computer lab, which was also open 7 days a week. Good internet connection within the campus premises, and the support system that I had, or that all the students had within the student system itself, starting from my fellow colleagues to SIs and student assistants. Yes, student assistants. And with that being said, ladies and gentlemen, when the COVID-19 spread got to South Africa, that resulted in the nation going on national lockdown, which meant that universities and other institutions were supposed to close, but which also added anxiety to full-time students, because now we were then expected to do everything online. And for the very first time, this is something that everybody will agree with me when I say that Ifundi became different and difficult, because back at campus we would use Ifundi maybe twice or 3 times a week, or 3 times a week. And now we're expected to do everything online. And for those people who don't know what Ifundi is, it's actually an online student portal where we use to submit our assignments, do quizzes, and so forth. So that itself became a challenge, because in order for one to access Ifundi, you need data and good network connection, which for some of us was a challenge, mostly for those students who are from rural areas, because now having to do everything online and having to stress about network made school even more difficult. Another issue was the fact that as much as lecturers gave us enough time to study for tests and assignments, they sometimes would not give us enough time to complete those things online. For an example, imagine being given 20 questions to complete in 7 minutes. Yes, that's enough if you're a student who has studied and who's at a place where there is good network. But for a student who has studied and is at a place where there isn't good network connection, that itself became a challenge. Another thing, as Busi mentioned, the issue of having to do everything on the phone. When it came to typing assignments and submitting. And this is something which I also experienced myself, as 2 weeks into online learning, my laptop crashed. So now I had to switch from doing my research and typing at the same time to now having to do my research, scribbling the key points, and then typing, which also slowed down my pace and resulted in me submitting some of the assignments late. But the pandemic, ladies and gentlemen, it did not just leave us with bad experiences as IKS students. It actually left us with life lessons, such as being able to adapt to any situation, working hard, having perseverance, and also gave us a confirmation that Indigenous knowledge systems has got the potential to compete on a global scale. As this is something that everyone will agree with me when I say that more light has been shed upon Indigenous knowledge systems due to COVID-19. Now, most countries are using Indigenous knowledge systems as a springboard to curing coronavirus, and also finding a possible cure for this virus. And also the fact that now it has also proven to us that it has also proven to us that Indigenous knowledge systems is just as important as any knowledge in the world, and it has the ability to solve modern day problems, as well as the ability to compete on a global scale, which means that for those students who are doing Indigenous knowledge systems, the future is very bright for us because doors are being opened for us, and this is a time for us to prove ourselves to the world that Africa and its Indigenous knowledge has the potential to make it, and it is the future for the world. And with that being said, ladies and gentlemen, let us continue being proud of our Indigenous knowledge systems, or as we say it in my language, in Xitsonga, thank you.
Thank you so much, Ms. Risimati. It was nice listening to you. Thank you so much for sharing your experiences. Once you move into the postgraduate environment, the experiences change a little bit. It's still a challenge within COVID and within the online environment, but the postgraduate student goes through a different life cycle. So let's move to the postgraduate students. First up, I'd like to welcome Ms. Mokoma.
Good afternoon, everybody. I don't know. It seems everything that I want to say has been said the previous speaker, two previous guests. Especially when it comes to home disturbance, guidance, consultation, data, internet, is the same thing that I prepared to say. Maybe I should start saying, in the beginning, for me, it was awesome just to to work from home. Until it came too much. The disturbances from home when you have to work, like at the moment, my grandchild is crying his tears, his eyes out there because he wants to be with me, not with the name. And for me, that's a challenge that is very much disturbing. If you have work to do and then you have to stop and add to whatever is taking place at home. So if I were able to go to campus and do my work, then that would be very much better. When it comes to guidance and consultation, I concur with the two speakers because I believe in a Sesotho saying, "Tabadi mahlong." It's easier and better to see when you talk to when you are on a one-on-one correspondence with whoever you wanted to consult with. If I may give an example of a permit, I don't understand this technology as much as the young people understand it. I was supposed to get a permit by doing the post-test in the COVID test. That was a problem for me because I did the test, but when it was supposed to give me the permit, there was no permit. I phoned several people, go to do this and they go to the DI and so on. And I couldn't get through until I went to the frontliners at the gate, where they helped me to sort this problem out. So one-on-one for me became a problem. The connectivity, I think because they have already said a lot about it, I had the same problem with the connectivity. Last week, including yesterday's dry run, I missed it because of the connectivity problem. So I think if I was at the camp, I wouldn't have had such a problem. I was even afraid, even today I'm going to have a problem, but at least it has balanced the situation. And again, once you come into, you get a problem with the resources that you're using and you are not techno-savvy, you tend to have a problem of fixing whatever problem, however small, to others who are techno-savvy, it becomes something very small to fix the problem. But because of, especially under level 5, one couldn't be able to to ask someone to come over or to visit someone to fix the problem of whatever technology problem you have. And then the engagement. I had started my pilot research before COVID-19. By the time it was announced that there's a lockdown, I couldn't go on with my research because of the lockdown. And then I lost too many people to COVID pandemic who were in line for the research. So that experience has had a very negative impact on me because of, I don't know if after this I'll be able to find such knowledgeable people as they, although I know there are others, but how to find them might be a problem. The ESCOM blackout also had a negative impact in such, once you are used to electricity, candlelight becomes a problem with under. So if one was at campus, one would have the opportunity of a kick-in generator to continue with your work. So one's work had to be stalled for that moment until the lights were back. Maybe the following day, not the same day. And then the last thing that I would like to touch is the exercise. I understood from one of the presentations on TV that exercise helps in boosting your immune system. So the COVID-19 really has stalled one exercise moment, especially if, like me, I don't really like to exercise. So moving up and down has an impact on my health, in boosting my immune system, because of I had to try to be to exercise from home. So I did, if I were moving up and down, going to campus, that would have helped me a lot in seeing to my.
Thank you so much for those points. We really appreciate it. I mean, you've covered so many of the different issues. Thank you. We all had to adapt, haven't we, to the environment that we're in and this online thing. Even myself, you know, I'm a bit of a laggard when it comes to accepting new technology, and getting used to all of this is a huge challenge for us. Stay strong, and thank you so much for your contribution. Ladies and gentlemen, let's move on to some PhD candidates. And first off, Mr. Nhdlovu.
Thank you very much, colleagues. Am I audible enough? Yes. Okay. My name is Tshepiso, as articulated. I'm a PhD candidate at the IKS Center under the topic of medicinal plants of childhood that are used for childhood diseases and the associated economics in the province of the Northwest province. So the aim of this study is to document medicinal plants that are associated to childhood diseases, and also to see if medicinal plants that are associated contributes to the livelihood of the traditional healers who have knowledge about these medicinal plants. So far, so good. Everything is going on proper. As I have 2 or 3 things that I would like to say. The supervision team has been doing a great job, and in terms of providing feedback and also me sending the work, it has been great working with them. The only issue that is currently hindering is the issue of data. As a postgraduate data, we didn't receive any data, most of us, to support our research, as we are working from home to research and to search for new materials. And the other thing that came from this pandemic is the issue of ethical clearance from the university, whereby you apply and it takes time to be processed, maybe the OPE, because of there are a lot of issues with regarding to people, a limited number of people who are going to work, so on and so forth. So in terms of community-wise, it's very difficult to access the community because of most of the people are now scared of this pandemic, and then you need to make appointments which may prolong the study in terms of permitting, issuing permitting or getting permitting from the university or the ethical clearance, which also slows the progress. The other aspect that I would like to think of is also with regard to publications, because as a PhD candidate, you're all aware that we need to publish and do other aspects. So in terms of this pandemic, what it has brought to us is that you find that you submit a manuscript and it takes much longer to be reviewed. But then this is out of the hand of the IKS Center. It is a national thing and also an international thing. But then from my experiences in terms of postgraduate research from the IKS Center, it's been great. Everything is going according to the supervision, and also the IKS Center is providing us with supervision that is good, and I cannot complain with other aspects. Thank you very much.
Mr. Mashego, is this your experience as well?
Good afternoon. Yes, the experiences are almost the same, yes, and they almost mimic each other, but then at different levels. But for me, my experience would be that the pandemic has exposed a lot of challenges, but it also provided us with a lot of opportunity, because taking a look at what happened during the Artemisia Afra issue, when the Artemisia in Madagascar, where it now gave an influx of young people being interested in indigenous medicine. On social media, we could see a lot of people posting about that. And for me, that was sort of like an opportunity for us to can explore in terms of research, and for those of us in indigenous health to actually use that platform to sort of inform others about our research in IKS. For instance, myself, I recognized that there were some people who were actually using, they posted medicinal plants that were not Artemisia afra, but which looked like it. So it is also, it provides an opportunity for us to also teach people about what we do here. We have conducted a lot of research. We are reading a lot of material which can be beneficial to the community at large, not only the rural community, but those technology savvy young people who are on Twitter, tweeting every day. It gives us an opportunity to also inform them about what's happening here and what are the benefits that can come out of the IKS Center in terms of providing solutions for the current challenges. So for me, I would end it there because we've already said a lot. So I would end it with the famous Frank Fanon quote, which says, each generation must, out of relative obscurity, discover its mission, fulfill it or betray it. So for us is to discover our own mission and fulfill it. Otherwise, if we do not use this IK that we have here and the resources that we have at our disposal, we'll be betraying the mission that we are supposed to have. Thank you.
Thank you so much, Mr. Mashego. We really appreciate your insight and contribution. Right, a last word from our postgraduate students before we get to some of the other experts. Mr. Maditsi, we are in your hands.
Thank you very much, Program Director. I'm Otsile Maditsi, a PhD candidate in IKS being supervised by Professor Materechera. Currently, I'm focusing on decolonization of how universities conduct their community engagement. So what we and Prof have established is that, a lot of community engagement that we do as universities is within the Eurocentric paradigm or within the Eurocentric lens. So we thought that maybe we should try and come up with an African-centered approach to doing this community engagement. So now we realized that there was a huge gap between universities and the society, which now needed to be addressed. So we coined a new term that we call it an indigenous communities of practice. So we believe that these are local organizations that exist within local societies, whereby these organizations meet regularly to overcome challenges that they come across in the society. Now, having done that, we said that this is now an explorative study. The advent of COVID-19 now distracted what we and myself and Prof were trying to do. We had to go to the communities and identify first these indigenous communities of practice. Now, for us in the IKS, our laboratories are not there in the universities most of the time. As researchers in indigenous knowledge, our laboratories are the local communities that we work collaboratively with. So Dr. Koitsiwe said that now we have to establish local networks, and we have to work collaboratively so with local organizations. This is the case that we are making with Prof about this indigenous communities of practice, saying that this is now the right way or the right approach that universities can use, or the universities can learn from, in order for them to foster a meaningful community engagement. Lastly, with this COVID and everything now, the national lockdown and everything, we realized that there is a need to now assess or examine the impact of information communication and technologies in conducting community engagement, in driving how the university departments do their community engagement project and activities. Now, myself and Prof then decided to add another objective into the study, whereby we'll just explore how these ICTs can influence how community engagement can be done. So not all was lost because of this COVID. A bit of positive things came out of it. And now we are bringing out a study that is going to be a very unique one, and that is going to be centered in an African worldview and an African paradigm. Thank you very much for that.
We appreciate your contribution. You've mentioned the community in your address now, and that's exactly the theme of our next speaker, community engagement, of course. So welcome to Mr. Diratsagae. It's nice to have you here as well.
Good afternoon, colleagues. My name is Monnaruri Diratsagae. I'm a lecturer at the IKS Center. I'll be discussing the impact of COVID-19 on the IKS and community engagement. At IKS, and of course at Northwest University, community engagement is integrated into core business, which is teaching, learning, and research. Sorry. The main goal is to effect measurable changes in our communities beyond the scope of any specific project, and to ensure that these positive changes prevails while our students are all provided with the opportunity to integrate theory and practice. And community engagement is at the center and at the core business of what we are doing at IKS Center. We teach indigenous knowledge systems which exist within communities, meaning that without communities, we cannot access this valuable knowledge if we don't do community engagement. You remember during the Ebola pandemic, there were so many aspects of Ebola pandemic in the Western African countries between 2014 and 2016. There were many aspects and international ones, and some organizations who were brought together to develop a guide for conducting research during a public health engagement. The team of experts emphasized community engagement as an important phenomenon during public health emergency to strengthen and promote public trust, and as an essential in ethics of ecosystem of research. They further outlined that public health emergencies may be amplified inequality in communities and institutions in unprecedented way. Hence, community engagement becomes important as it has potential to contribute to share, understand of priority needs of communities, and in the best way to meet those priorities, you need to include the role of communities that they can play around issues of a public pandemic. And World Health Organization in 2019 has also highlighted that community engagement can play an important role in preventing and transmitting and controlling coronavirus disease. This is what the World Health Organization did in 2019. World Health Organization also put community engagement at the center of everything. However, under COVID-19 pandemic, when one thinks of community engagement, someone has to deal, especially as a researcher, you have to deal with so many questions because of the nature of the virus and the national response strategies. Response strategies such as social distancing, which has challenged traditional methods of community engagement. And you understand that IKS, in order to conduct IKS research, like Mr. Maditsi indicated, that our laboratories are our communities. You need to do face-to-face interviews, group interviews. And in some communities, as you visit communities, before they can give you access to that particular community, they have to call a meeting first and introduce you to the community so that community, they know that you are there to conduct the research on a particular phenomenon. Since the COVID-19, that is not possible because of the number of people and observing the social distance, because the communities are not allowed to call meetings so that you can be introduced. So it makes it difficult to conduct a research, a quality research on indigenous knowledge system. And then some of the questions one will ask is whether and how to engage population about COVID-19 generally. Engaging population about COVID-19 generally, it's very difficult because now our communities, they don't trust. You remember the interview that was held by one French radio French, somewhere in Africa, where the speaker there says, we'll start with our test here to get vaccine and whatnot. That on its own, it has a serious impact. If we have to conduct a community engagement, particularly on health issues related to COVID-19, whether you want to investigate how indigenous medicines can contribute, it poses a serious challenge there. And so you have to also ask yourself whether to engage about other non-COVID-19 research, like Mr. Maditsi, Mr. Nhdlovu, the Ph.D. candidates. It's not easy for them to conduct the research because of social distance and other regulation imposed by government. And you also ask yourself what to consider to take forward post-COVID-19. And IKS generally, it has been affected. And at IKS Center, we've been managed to talk to our partners, but the communities who are at the center is a problem, as some of our postgraduates cannot access our communities and use their phone and WhatsApp and web-based things, because they have its own pros and cons, advantages and disadvantages in terms of conducting quality community engagement research. So generally, I agree with Ntate Motheo where he says we need to develop community networks so it can be easy for us during the public pandemic such as this. You can easily access communities, can contact them, engage with them through Zooms, Microsoft, all these web-based communication platforms. I thank you, Chair, in the interest of time.
Thank you so much, Mr. Diratsagae. It's so insightful to listen to you. Thank you very much for your contribution. Ladies and gentlemen, we also have the privilege of having a traditional doctor here today with us to deal a little bit with the issue with regard to traditional health practitioners. So I'd like to welcome Dr. Mooki to our webinar. I'm sorry, Dr. Mooki, we seem to have technical difficulties. You're breaking up and we are unable to follow. So we'll try to get the connection going and perhaps return to you a little bit later on. Whilst we sort that problem out, we also have Dr. Sedupane lined up here today. And as always, Dr. Sedupane, we look forward to hear from you.
Good day, colleagues. It's a pleasure to be with you again today to discuss BIKS and COVID-19. I think what COVID has done, it has brought to our minds to ask ourselves questions about what we do, how we do it, and why we do it. The most important thing that I've come to see is that there's a need for us to have a more critical education. Western education mostly relies on theory, memory, whereas Indigenous education relies a lot on practice and on doing and on creativity. Now, as the BIKS coordinator, I asked myself the question: if a student who has done our course, how have they responded to this crisis? Is that the things we have given to them, are they able to carry them through this crisis and even others which may come in the future? The student has done the Greek program or stream in our BIKS program. Do they have enough knowledge and skills to be able to provide food for themselves in case that there are food shortages, as you saw when this lockdown began? Your students who have done the health stream modules, do they have enough knowledge to assist themselves or family members in the case of their health failing in this time of crisis? So as we engage in the BIKS review, and as we plan for the future, it's important for us to really look at making stronger the elements that involve practice, putting to use the things that we know about IKS, not just what do students know, but what can the student do when they are done with the course. I think that's what one big thing which COVID has done is to ask us how much of a real impact will our graduates have on the real world, doing real things, facing real problems. So that's what we want to do going forward, is to increase the critical component of our students' work as we progress with the program. Thank you.
Thank you, colleagues. I can realize that GP has ran to his conference, as he indicated. He's hosting another event. I wanted to check, Tate Mooki, are you back?
Can you hear me better now?
Yeah, I think the audio is much better. If you can do your presentation, it will be appreciated.
Okay, thank you, Doctor. Afternoon, colleagues. About next evening. What I wanted to say was, to meet a different situation. Like if COVID-19 has stolen a lot of us, it's turned the world upside down. It has presented a challenge to us, and a very big challenge. It has put us on a big foot. One of those changes is research that has been lost, which holder the USCT has been worked on. And we need to find a way to how to cover that. And also, colleagues, aptly as the knowledge holder is to say to the risk communities and to government at large. Let us work together and find a way of this. As we still have a lot or something to offer. Setswana in the post like Taunan Sebua, Tiwa Kemetro. A nation that is not working together, we end up losing a lot. And why we have a lot to get on the table and in the way or we use it. For the use of time, thank you.
Thank you, Remoki. Thank you very much for your presentation. I want to check if Prof Materechera is there. I saw another user, but they did not have the name. Prof Materechera, are you there?
I am the chair.
Okay, thank you, Prof. You can take over.
Thank you, Chair. My name is Materechera, and this morning I just want us to focus a little bit on the impact that COVID-19 has had on our food and nutritional security. I think all of us have experienced, all of us have seen how this pandemic has disrupted our tradition of food production and supply chains. We have seen how the availability of food has been affected, especially when we were in lockdown levels 4 and 5. We have seen how the quality of the food and the safety of the food has been affected. We have even seen how the sovereignty of food has been affected by this pandemic. And I think it has left all of us with a thought on how we can actually handle our food production and supply chains. The pandemic has necessitated us to have a paradigm shift in the way we think about the production of our food, in the way we think about how our food is stored, is processed, is packaged, is transported, is distributed, even the way in which this food is cooked, consumed, and the waste is disposed of. And the pandemic has revealed to us that we need to have systems of food production and supply that are resilient to some of these natural problems. And I think that's where Indigenous knowledge systems has a role to play, because Indigenous knowledge and systems provide us with resource in terms of the production systems and production and technologies of processing the food, technologies of preparing the food, technologies of even storing this food. So I think we need to think deeply on how we can integrate this knowledge into our food systems today so that these systems can be resilient, these systems can be sustainable. Apart from technology, I think Indigenous knowledge systems has a role to play in urban agriculture, because the pandemic has revealed to us that food production will now not necessarily have to depend on rural areas. Even the urban areas have to participate in the food production chain, not just the production, but also the value chain itself. And so it brings into a fore how urban agriculture can be integrated and what role Indigenous knowledge can play in this urban agriculture. We have conducted research ourselves in our local town here, and have seen that Indigenous knowledge and Indigenous production systems are playing very minimal role in the food systems of this town. And I think there is need to see how we can enhance such research, not only in Mafiking, but other urban areas across the country. Thank you, Jay.
Thank you, Prof. Materechera. I think we are doing very well. I see that our last speaker is Dr. Professor Aremu, Oladepo Aremu, our IKS postgraduate coordinator. Prof. Aremu, are you there?
Yes, thank you, colleagues. Thank you, Chair. I'm available.
Yeah, yes.
Yes, the name is Prof Aremu. I'm in charge of postgraduate students here in IKS Center. So this morning, I'm supposed to just give a brief overview in terms of research and COVID-19. Looking generally, we've discovered, and as many speakers before me have to, there is no running away of research. That's what we get sure. That's why we get first way out of problems. And I would just like to highlight again, we've actually given our students the platform in order to see how they can actually help answer this problem, this particular problem of COVID-19. And in the last few weeks, we've actually gotten a lot of requests from healers. That's to show you that we are quite relevant at this time. But one thing we've discovered is that research cannot be done in isolation because the problem is multidimensional. No, this is just to highlight that in terms of research, we're quite ready, and our postgraduate students are actually, though they've been affected in one way or the other, especially in terms of data collection. Nevertheless, we still see a lot of opportunity that this COVID-19 has actually showed us what we can do. And it has actually put us on the map out there that we can actually think. We're not now thinking for COVID-19, we're thinking for the future. So it has given us room to expand, and we've been talking with different stakeholders. So going forward, there is even more opportunity for other students to come and do their postgraduate study here, not just on medicinal plants, but also on other social issues, which are quite relevant, as we've seen during this COVID-19. A lot of potential exists here in IKS Center, and we are just making this a call that people should come for postgraduate study. Thank you very much, Mr. Chair.
Thank you, Prof Aremu, and thank you all the colleagues who have presented today. I think we started with the undergraduate student, Mrs. Busi, who was followed by Vanessa, and also followed by Mrs. Mokoma, Mr. Nhdlovu, Lesley Mashego, and Mr. Diratsagae, and then Mooki, and also Dr. Sedupane and Prof Materechera. I think the presentation, as you could hear, they were actually speaking to each other. And I think we also were supposed to have a poet who was supposed to give us some reflections around poetry, but I think due to issues of connectivity where he is unable to join us online, but we're trying to devise other means because technology always gives us the opportunity to see how we can always try to come up with solutions to make sure that our things are okay. So I will try by all the means before I bring Tate Chuma to say maybe we can have our poem. I think the technicians are there behind and they will try to do that for us to make sure that we can have that poem. But nevertheless, I can see Refezile Vutela is also there. I also would like to recognize him from the Office of the Premier, and I see Rachuma. I would like to slot you while we are still trying to get the poem, because I think those vibrations and presentations from your side as a message of support outside. And Tate Chuma, let me get you on board to give you time and to give us your message of support from the DGG office in the Office of the Premier. Thank you very much.
Thank you very much, Dr. Koitsiwe. And good day, colleagues from the university. I think this is a brilliant initiative, and you see, they say that says, for every dark cloud, there's a silver lining. I think COVID-19 has exposed us to the silver lining in real terms. because it wouldn't be easy. I don't think we would have found ourselves as government and the university, but in particular, the component or the compound on IKS. I understand that IKS, it's truly about, you can't speak IKS without the communities. So it's because of the communities that we do have IKS. And similarly, we would not be having the public sector or public service if we do not have the communities. Therefore, we are finding each other embedded on the same principles. And therefore, it means to me, there shall not be government without IKS. For you would only find communities who are defined through IKS for their existence so that we can also deliver the government services to them as such. So I think it's high time for government to begin to redefine what it means for it to deliver the service. Because if we say that we are here to serve the communities, these communities are defined within the concept of IKS. So therefore, as government, we must by all means try and see how we mainstream IKS into our government programs. Now, we do have an MOU with the university that was signed. And within the MOU, IKS is one of the elements that has been listed there. But after having interacted with Dr. Koitsiwe in our first meeting and having to understand what IKS stands to mean, I came into conclusion that IKS must find expression in all the items of collaboration that we have identified as government. Because how would you talk engineering without acknowledging IKS? How would we speak food security without IKS? And how would we speak social cohesion without IKS? How would we speak all these other elements without mainstreaming IKS into them? So as government, we are ready to work collectively with your good selves. We are aware that we're supposed to establish a technical working committee that is going to ensure the implementation of the spirit that is contained within the MOU with our good selves. And when I'm seated here, I'm saying we are full behind you, because the vision that one would have and the vision that one would actually sell within government, and which is what government is currently focusing on, is that in relation to our youth, we must ensure food security. And how do we then bring IKS into the picture to enable food security that must be implemented through our youth program? How do we ensure talent development and management through IKS? How do we support entrepreneurship through IKS? And how do we ensure cultural edutainment through IKS? It's desired that at some point, if not in the country, but at least in this province, we must be able to establish the institutions that are guided by IKS principles to monitor and coordinate the food industry in the country. I know that we've got South African Bureau of Standard, but how much of IKS has found expression in that? We also need to look at whether we should not provide a choice for our people, that as much as we've got medical facilities, can't we begin to have herbal facilities? When you talk about medicine, how come that herbs as part of IKS are not actually found on the same level, if not above medicine? And I think COVID-19 has proved to us to date, most of the recoveries that have happened are people who have relied on the indigenous knowledge system on how to administer the herbs intake for their survival. It's on that note, Dr. Koitsiwe and colleagues, that we are prepared to ensure that we've got clear terms of reference on how the workings will be. I have interacted with your center in the university already, I think at some point the university wanted him to run with establishment of the technical team. I've made him aware that I have been interacting with Dr. Koitsiwe in the Directorate School of IKS. And he said that we will be able to meet at some point so that we can then see how we formalize our interaction so that we have got clear project plans that are costed so that we can resource our effort and have an end product that we all be happy about. Thank you very much and good luck as we continue the interactions. Thank you, Doctor.
And I also see GP, my brother, you are back from that other side. Thank you very much from your technical point of view. Rachuma, re a leboga re lebogela puo e o e buileng ya botlhokwa go tswa ko ofising ya mopremiri wa rona mo province ya Bokone Bophirima. Dintlha tse o di buileng tse o di botlhokwa, what we have just said is very important, and I think we take heed of that. And as the IKS Center and the Faculty of Natural and Agricultural Sciences, and I'm aware that my executive deanery, they are also part of this meeting. They are on the other side. You can see them from the participants. They are listening very well, and I think we are going to make sure that when we go forward, we do everything as a team. And in the final analysis, we want to make sure that we use IKS as one of the instruments to ensure socio-economic development, and our own communities, as we have indicated, should be the core beneficiaries of whatever that we are doing. I will allow my brother GP to do as he can to play the poem that we actually arranged for breaking the momentum of this session, because as IKS, issues of heritage, culture, science and technology, health systems, and issues of agriculture are very pertinent to us. And as our vice chancellors and the other management structures in the university have said, that they want to make sure that Mafikeng campus becomes an IKS and agricultural hub. And I think also we need to add also economic issues around those two issues that the university have identified. The MOU will be our basis for working together. And I think whatever that we'll be doing, it will be based on the district development model that government has also come up with to ensure effective coordination, planning and implementation of our own project. So let me give GP this opportunity now to throw the poem. GP, it's all yours.
Thank you, Dr. Muteu. And I tell you, listening to all of you speak, it just confirms the incredible field of Indigenous knowledge systems and what it has to offer, both in terms of breadth and depth of academic study and the impact we have in our communities. But you've heard now the promise of a poem, and we are very fortunate to have a poem ready for you. It is by Tau Ya Poko Dire. And ladies and gentlemen, enjoy.
He tlheng lefatshe le bone se ntlhaga tsa phika tsatsi le penne tadi ya musa motshegare mogolo a sethoboloko. Lefatshe le bone selo se se nang pelo tlhomogi segajaja. Segajaja se meno a tlhabang se ka ditlhabano tsa batlhabani. Segajaja se jang ngwana le mogolo se buduletse. Maba yo o bolayang gotlhe matlo a fetoge matlotla ka motsotso. Kwa China kana gatwe matlo ke masiela bana ba iketse badimong. Italy teng matlo a tswetswe ka matlhaku maloba a tlhola. Mono lapeng ya re tshwaraganya ka meriri madirelo a tswala. Ka se titiripanya molato wa tswa ka dinela ya supiwa ka monwana. Motsoko le kgatsele a tau ya nna dilo tsa maloba merafeng. Kana selo seo se rata selelo sa motho phetelela, se sule letswalo ka le lesea se sa boifi go le bolaya, fa e le bagodi bone ba tswa setlhabelo ba sona, mabitla a tletse phetelela ebile a penologa, maokelong gona motsetse o jaaka seatla sa gadime matlhotlhapelo a Batswana. tlheng ba tshola kitso dirisang kitso ya setso le tlotlo la ngwana wa mmala wa sebilo kana mma ba o re tseneletse ka mabole ebile re mekhino lefatsheng go tobekane go tlhakantshuke go rena loso letlhogo le kilo go sekgolo epa pitso matweto a tshellebola tšhaba sa gago se bone kagiso nka bua letsatsi le ka tlhabala kolometsang ko kgaleng ya bophirima tsholofelo ga e tlhabise ditlhong batswana tlhennelwang ke pula medupi ke dule.
Beautiful. Thank you so much. Just the name again, Tau ya Poko Dire. Thank you so much. We really appreciate your contribution to our webinar. Ladies and gentlemen, we are at the point where we are going to give Dr. Mateo a chance to give closing remarks. Before he takes the floor, please contact us. If you want to know more, we have the experts in this field available. We're at the cutting edge of what happens within this research field. If you need us or if you need to know how to approach us, feel free to contact us. You'll have our details here on this webinar, or just visit our website or follow us on social media. But to conclude this webinar, I'm going back to the director, Dr. Mateo. Please take us home.
Thank you, GP. I think let me first take this opportunity to thank you and also your Office of Student Recruitment and Marketing. I think you've been doing a very fantastic job for us, because one of our core duties at the IKS Center is to make sure that every year we've got students, undergraduate and postgraduate. Without the students, I think the IKS Center can also be closed anytime. So the students are our core clients, and that's the reason why we are here. But also, it is very important to make sure that as the IKS Center, we can't do this thing alone. Your intervention since last year has always given us some low-lying fruits, and I think it's very important for us to continue that, to ensure that we have got a very radical strategy of making sure that we market IKS in all the platforms. It can be social, it can be face-to-face, we can be in the radio, we can be everywhere. In the past, before we get people like you on board, I used to be the one who was running around in the communities, delivering forms to students, doing talks to students, and also on radio and on TV. But I think to have a multifaceted and interactive approach of marketing IKS is all that we want. And I also want to thank my colleagues from the IKS Center, the staff members, starting with Prof Aremu, Professor Materechera, Dr. Sedupane, Dr. Monnaruri, and Mr. Maditsi, and all the students who participated, Messiano King, Mokoma, Tshepiso, Valisa, and Busi. I think we've got a very strong team, as you can see. I call them the cadre of IKS ambassadors, these young students, because these are the students that we are going to use in the province, in the country, and also in the continent at large and globally, to make sure that we have people who are driving IKS in the front. And I think we do have the support from national government, and as we have seen, the Rebut has also committed themselves from the provincial government, and we are very grateful of that. We have already started to have engagements, and we are going to work very hard to make sure that we establish a technical team that is going to have people from government and from us as a university to make sure that that memorandum of understanding is implemented. And we are also going to bring some of our partners on board, like your CSIR and other relevant stakeholders. Colleagues, I also want to thank Mr. Fezile Vutela, who also joined us. And I know there are also people on the background from the Premier Office, Bomme Oratile, and people also who represent the Premier also on the background, because with the support of the Premier Office, I think we do have the entire province in our bag. And I think it's very important for us as the IKS Center to be strategic, because IKS is a big elephant and we cannot do everything at once. We need to have those strategic focus areas that we can be able to look in terms of 3-year planning, 5-year planning, and also maybe to see how along the way we can have more long-term planning in terms of having other core objectives and other strategic departments to be part of us. And I think, and I'm very positive that we really need to make sure that even some of our students, who graduate from the university could find their doors open within the provincial government in various departments where they can have internships and where they can also be, given opportunities to join very strategic positions in government. And I look forward to also work with the government to make sure that we do workshops, because some of our governmental officials, they have got no clue about what IKS is all about. So we need to have those workshops with these government officials so that they can have an idea of how they can integrate IKS within their departments and create opportunities for our young students and also the knowledge holders. I would also like to thank Mooki from Northwest Diratsagae Association. He's a traditional healer. We have been working with them for more than 10 years and 15 years as I can remember. And I think also, colleagues, I can also take this opportunity to say that we are looking forward now to also host the IKS or the recognition of prior learning pilot project in the Northwest province, where we are going to work with traditional leaders and traditional healers to finalize the issue of developing the norms and standards for accreditation and certification of Indigenous knowledge holders using the South African Qualification Authority model of the NQF levels and also the SAQA descriptors, which we have also developed our own Indigenous knowledge descriptors. And I thank the DINARI and the DVC for Research and Innovation for also coming up with the protocols that will allow our students to now go to field work and start to do their work, because I think it's very important that for 2020, we do have outputs in terms of research. With those few words, colleagues, I can see it's 1:30. Mr. GP, this is how we plan, myself and you, that by 1:30, we will be closing this event or this live webinar. And finally, colleagues, I guess I can say, as you are aware, we do have another research webinar in the evening at 4 o'clock, which is a collaboration with the Namibia University of Science and Technology. There will be very wonderful speakers also who will be dealing with the issues of therapeutics and archaeology. So this is some of our responses in terms of research and collaboration with regard to COVID-19 and how, we foreground and we put IKS as one of the contributors towards solving these issues. Not only IKS and also the voices from humanities and also social sciences. Bagaetso, bo mmalebora, ke a leboga. Damesen here, I guess, via Blay, Ferhiri Black, and we are looking forward to make sure that whatever that we do, language becomes the key business of whatever that we do. Because I also believe and share sentiment with some of my colleagues in who praat Afrikaans. Hulle said that die taal van die mense is belangrijk. As much as people are teaching in Afrikaans in Potchefstroom, I think we also want to do the same here in Mafikeng campus to make sure that we don't look at language as a barrier and as a problem. We now look at language as a resource for the liberation of our own people. With those few words. Pula.